good thing. You know.
And tonight I'll be passing out my crown because I'm friend. By the way, I'm friend.
Friend, yes.
Yeah.
Okay.
So good luck, everyone. Stick to the program and you'll pass.
Hold on a second before you go. You know, how long did you study for?
I signed up in December, but I didn't start to study end of January.
Yeah, you studied really hard. You completed all the question banks and all the diagnostic tests and all that.
Everything. I did everything. I did everything. I did the crash course 3 times.
Yes, I mean, why not? You know, I mean, it's give you, you know, it's not limited to how many times you can attend. I would come to the crash course 3 times too if I had this test, for sure. So that's good. That's good. What was most helpful for you?
I think the live classes help a lot because listening to you, it's thick. It's
good.
Yes, good. The live classes helped a lot.
Awesome. I'm glad they did. So
questions, doing the questions over and over helps also because once I've seen something done the exam, I was like, that's it. That was it. I didn't take like, you know, I just click on the answer and then keep going because it's the content. As long as you know the content, the questions can be like, you know, different, but if you know the content, you'll know the answer. So
exactly.
Like I'm like, know the content. Don't try to memorize
it. You know, like I said, that was a person that did 10 times each diagnostic test. That's not a good way. I know our diagnostic tests are very high yield, but it's not. It's just because you guys study. And we go over everything multiple times in Cahoot, in live classes, in WhatsApp, in so many ways. When you get to the test, you will be ready if you do the right things. Now, joining the course is not a guarantee to pass, right? Unless if you do the right things and you study and you go over everything. I mean, it's, you know, that's what I'm trying to tell people that just join and say, oh, I'm going to join and try to rush in the last 2 weeks. That is a recipe for disaster. But if you do the right thing, I promise you, it's almost impossible not to pass.
And also take your time. Don't rush. Don't rush the process. Take your time. Like I was getting stressed because most of my classmates were passing, but I had a plan. I was like, you know, I'm going to give myself 6 weeks to study.
Perfect.
Because it's stressful when everybody starts passing and then you're still here.
Yeah, no, I know, but you know, it's the perception that the other side of the fence is always greener. But you know, they probably went through the same stuff that you did, but a little bit earlier. So, well, congratulations, both of you guys passed. Tons of people passed in the last few days. It's always the same thing right after the crash course. So guys, know when there's a crash course. Next one is going to be April 25th and 26th. It doesn't mean you have to test immediately after, but if you have an option between, you know, extending your test for 1 more week and catch the next crash course review, I would do it. 1 extra week is not going to hurt you. We don't charge you for the extra crash course review, so you can come in. So there is no reason why not to. It's not going to make a huge difference, but it can make a huge difference for you, just in case if you need a few extra questions that you might see the topic in our crash course review. So congrats. Tina, yeah.
Come into the Cahoot, do the Cahoot. It helps a lot with speed. Even though you have like 3 hours and a half, like time goes by fast. So the Cahoot really helped me.
Yes, and then today we have a lot of special teaching in the Cahoot today. So stay tuned. So I did a lot of extra today, not on the questions, but like teaching along the way. So it's going to be a little special Cahoot today. All right. I think let me see who else has hand here. It's Caller. Do you have a question?
No, I don't have a question. I did the pre-diagnostic.
Well, you got to come closer to the mic, though. You can't hear you.
I did the pre-diagnostic.
Okay.
and I didn't do good at all.
You didn't do good. So
No.
is this you talking about the pre-diagnostic test at the
Yeah.
end of the course, right?
No, the beginning, the
Oh,
first
okay.
one.
No. Oh, so don't worry about it. I mean, I know. So something's not right because you've been with us for a while. How come you're doing the pre-diagnostic test now?
Because I didn't do it.
Okay. So okay. All right. So stay back. Once we finish this, we're gotta do a little bit to talk over to see what we can help you with. Okay.
Okay.
So at the end of today, you gotta remind me because I won't remember exactly. At the end of it, I'll be too excited talking about other things here. But please remind me, okay? Don't let me go before we kind of do a little bit of talking about it and see how the diagnostic test went for you and how was your preparation. That may be helpful. All right. All right. Tina, do you have a question?
Hi, Dr. T. I do.
Hello.
Okay, I have done all your modules, and
You
I've
are
done
echoing.
all-
Is there?
Oh, I
so
am?
sorry.
No, oh,
Yeah.
hold on. I'm sorry. Okay, can you hear me? No.
Oh, I'm sorry. Perfect. Yes. Go ahead.
Can you hear me?
Yes, I can now. Perfect. I can hear you. Can you guys hear me?
Can you hear me, Dr. T?
We can
Yeah.
hear you.
We can hear you.
Hey guys, okay. So I have done all of the modules and I did all of the question banks, and then I was preparing to do the diagnostic test. But before I did that, do you think I need to do I believe it was your last crash course that you did live. You sent some questions for that in the email. Do you need to do those, or do you think I should just move forward?
No, you can move forward, but do the crash course review question bank in the question bank module, the day 1 through 4.
Yeah, I did those, the supplemental questions.
Yeah, you don't have to do those. Are you testing soon?
Yeah.
Okay, yeah, no, please move on to the diagnostic test.
Okay.
Now, before you do the diagnostic test, sit down and take it as if it is the real board.
Mhm.
Because you want to be evaluated like you would for the real board, right? Because if you just take it, you'll be like, oh, I missed a lot of things, I knew it, and you can downplay it. Prepare for it, like take a day or two, get all your notes together as if you are taking the real board, so that way it's realistic of what your score would be today. And then you take a day in between, and then you kind of like reassess your situation, see what are your weaknesses, and then you take the next test. Okay. Always take them as if it is the real deal. Close your door, don't shut your phone, focus, everything like you would for the real board. Okay. Here we go. Major, give a hands up. She passed. So that's good. Hey guys, follow up with, my pleasure. Follow up with your peers, your friends at the past. They'll give you the secret. They tell you, hey, this is how I did. This is what worked for me. This is the part of the course that it benefited me the most. Do this. This is why we have a WhatsApp with 1,000 people in there to ask you questions, to support you. All right. So is anybody, Scholar, are you trying to say something or? Okay. Is anybody not know how to play and would like to play? Okay. Robin. Everyone else, please pick up your phone. Open your camera. Look at the QR code in the middle of the screen. Here, I'm circling for you. Hopefully everybody can see that. Point your camera to the QR code. You need the phone in order to play Cahoot. When you do that, a hyperlink will show up. Click on the hyperlink and then create a nickname. You know you are in the game when you see your name show up here. So, and then you just wait for everybody else to kind of join us. We have a lot of players here today, so you just gotta wait. So Cahoot is a game of knowledge and speed, and you are disputing, you're competing for the podium against your peers. Guess what? If you make the podium, I can tell you right now that you will pass the board, because it's almost impossible to make the podium and not pass the board, because you're competing against your peers with similar knowledge that is in a course and so forth. So your goal should be always to make the podium. Now, making the podium is super hard, right? Because there's only 5 spots. That's it. So, and if we have 100 players, it's extremely hard. But it should be always your goal. Is anybody right now having trouble logging in? Sometimes they might kick you out. I see Major got kicked out a few times. So make sure that you know, you're still in the game, okay? Your name is here. All right, so we're about to get started in a minute or so. We got a lot of people here today, right? A lot of players. So thank you for being here. Today is going to be a little bit special. There's a lot of teaching with the questions today. Okay, so make sure you stay to the end. Make sure you stay. We're going to talk about logotherapy. We're going to talk about existential therapy, CBT, cognitive therapy, all kinds of things that are not only questions, but we're going to talk about those things that we covered this week on psychotherapy. So it's going to be very, very helpful. All right, folks, so we're about to get started. We are a few minutes in now. Is anybody still? Go ahead, Marsha. Do you have a question how to play or?
Hi, Dr. Lopes, I'm very sorry, but I'm driving. So when I said I'll join you guys, I just want to listen for today.
So you want to join us when you're not driving, though?
No,
you just want to listen?
I just want to listen, yes.
Yes, all good.
Like 1 hour. Thank you.
No worries. Just enjoy the class listening, but pay attention on the road, please. Alrighty. So, all right, last call. If you got a phone, you have to point to the QR code. Get your camera out. Point to the QR code. A hyperlink will show up. When it does, you click on it, and then you create a nickname. Don't be picking a nickname that's here. That's already taken, okay? Now, if your camera is not working, what can you do? You can go to www.cahoot.it, not .com, right here. And then it's going to ask you for a PIN code. And today's PIN is 4168764. And then you create a nickname. It just adds a few more steps, but it's a lot easier if you use your camera.
Dr. Lopes, what about if you just put your regular name? Is that okay?
Yeah, sure. But yeah, go ahead. By all means.
You.
Yes, no worries. We're going to talk about PAG, Erickson stage, lots of therapies, only therapies, in fact, right? Recovery model, trans-theoretical models, names. I created a chart for you with the most important names. So yesterday I was asking someone to write it down. So today I created one, and we can talk about those names. So that way you can take a picture and save it for you. Okay? Then you have it. All right, folks, we're about to get started. I think it's just about time. I'm going to give it exactly 1 minute grace here, and then we'll be getting started. So hopefully everyone knows how to log in. No one is stuck quietly and kind of wants to play but can't play for whatever reason. All right. You guys are doing great there. Lots of people passed the board yesterday, last week. I am stoked and excited for your new career. You know, when you pass the board, don't be a stranger. If you feel that you need help, you have your peers, right? So yeah, just today I'm gonna also give you the QR code for the WhatsApp. Maybe that way, if you guys have been saying, oh, I would like to be on the WhatsApp group, but you can't for whatever reason, stay tuned at the end. Remind me though. Oh, I might forget. So just remind me. I'll pull up the QR code and see if that works for you right away. You can join the group right away. Joining the WhatsApp group is a secret weapon. Lots of people pass in every day. They're helping you. They'll give you huge advantage for the board. So if you're not in a WhatsApp group, you're missing out. Now, the WhatsApp group doesn't stop. It's 24 hours, right? That can create anxiety. If that creates anxiety for you, don't be on the WhatsApp group. Be on our course forum. It's a lot more quieter. It's a lot more systematic. WhatsApp, it's like 24 hours. You can go to WhatsApp midnight. You have students that are talking about whatever all day long, 7 days a week, 365 days. It never stops, the WhatsApp, right? All right, folks, that's it. Welcome to Cahoot. We are about to play a game. Let me give you a little introduction. You know you are in the game when you see your name here, right? Now, you don't have to see it now. As long as you logged in, you should look at your phone. When you play, you answer the question in the Cahoot. I'm sorry, in the phone. My apologies. In the phone. 4 little boxes will show up and you select your answer. Cahoot is a game of accuracy. You have to get the question right to get a point, but also a game of speed. The reason why we do Cahoot is to get you out of the fence, get you to select an answer within 1 minute. Remember, if you have 175 questions, 3.5 hours, that's about 1 minute and 20 seconds per question. So here we're practicing just a little bit under of what you should be answering for the board. Okay, so good luck, everyone. Let's do this. That's it. How do I start? Okay, here we go. All right, 1, 2, 3. That's it. If you didn't join us, you're missing out. Bye. Let's do this. All right, 6 seconds, and 2, and 1. All right, so first thing is, I was circling the question of recovery model. When you see the recovery model, what comes to your mind, right? What is the recovery model? The recovery models can be used for anything, but the premise is, what is important to you? It's not about what medication should I use. It's not about the treatment. It's about dreams and aspirations. We can have the best treatment ever, but if the patient is not interested, it is not the best treatment. So here, which answer choices kind of talks about dreams and aspirations and, learning from discovery, things like that. Are you taking your medication as prescribed? Well, that's a medical model, right? Have you experienced any recent mood swing or manic episode? Again, it's tricking you because it's talking about bipolar. But is that the medical model? The recovery model? No, right? Do you have a family history of bipolar disorder or mental illness? Again, it's tricking you because the question was about bipolar. Which answer talks about dreams and aspirations and personal goals? That is the recovery model, right? So good job. If you were able to bypass the distractions, great. If you didn't, that's totally okay. You learn. So every time you hear recovery model, now you'll get the next question right. It's all about goals and aspirations. What would you like to do with your life? It places a strong emphasis on the patient's own desires, own aspirations, what they think is best for them as far as the recovery journey. It's never about the diagnosis, the treatment, or, it's all about helping them align what's important for them with your treatment. That is the recovery model in essence. Most of the time, that aligns with substance use disorder, 90% of the question, but it can be about other things as well, right? So if we break down the recovery model versus the traditional model, we say, hey, what is the traditional model? Well, it's usually an approach that's focused on treatment, the diagnosis, the symptoms reductions. I want you to cure you of schizophrenia, right? That is my goal in the traditional model, in the medical model. I'm all concerned about the treatment. Now, questions like, are you taking your meds? Have you had any mood swings? Belongs to the traditional model. The recovery model is patient-centered. It's all about the patient. It emphasizes what are your abilities? What can we do? Even if you have schizophrenia, for example, right? What are your interests and dreams? And yesterday we talked about the HHPC, which is the pillar for the recovery model, right? And the board loves HHPC, okay? So please know that, recovery model looks at the health, one's in managing one's diseases and making informed health condition these choices, the home, a stable home. What is your purpose in the community? What do you want to do daily in community, right? So here, if we say recovery model, forever you think of the patient being in a driver's seat. What are the purpose and how do they want to live their lives? That is the recovery model compared to the traditional medical model. All right, 1 second. Great. Absolutely great. Wow. Very rarely we have over 100 people playing the game and all of you guys got the answer right. Yes, because recovery model is non-judgmental, right? It's okay to fail and it's okay to get up. It's okay to cry as long as you get up and go, right? Because we learn from experiences and that is what's all about. Some days I'm not going to be at my best. And it's okay as long as I can pick up myself and keep on going, right? Learning from failures. It's all about the recovery model, high yield, oftentimes used for substance use disorders because there are relapse. And we don't want to say, yeah, I know you are going to relapse. But if it does, we don't cross a line and say, okay, you relapse, you're not coming back, right? We say, okay, what did you learn from that? So again, non-judgmental approach, learning from opportunities, learning from explorations, right? Understanding the recovery model. Once again, you need to know HHPC, health, home, purpose, and community. Here you go, Major. Give a hands up. You should know this, guys. She just tested, so that's good content. You should know this. You can take a picture of those slides that I made on the side as well. All right. So yesterday we talked about ACT, right? What is the goal of ACT? I really want to make that super clear because it's super high yield. What is the goal? The goal you should say in layman's term, please be in the community. Don't come back to the hospital. Don't come back here. We would love to see you thrive in the community. What is the goal of ACT? Is to keep patients outside the hospital. Which one, generally speaking, which of those answers kind of falls within this independent managing your condition outside of the hospital, thriving in the community? Okay, participation in recreational therapy and social activity. That is a close answer, but not necessarily the goal. The goal is to independent manage their tasks and responsibilities, being able to support them. And that's why the ACT model is one that is composed of 24 hours of healthcare providers, doctors, nurses, and folks helping the patients with severe mental illness, right? Helping them thrive in the communities, learning skills so that they can survive and do better. I know the blue answer was kind of tricky because it had therapy and social skills. I get that, okay? But the goal is, who are the people that would benefit the most from ACT? Oftentimes questions you will say non-compliant, your bipolar folks, your schizophrenia folks, because if they don't take their medication, they might be back in a hospital. So we want to emphasize the goal of ACT is to keep them in a community thriving, right? So ACT is an intensive integrated approach to community-based mental health care. And the goal is for the patients to live successfully in the community and avoid the revolving door of hospitalization. So what are the core principles? Community-based, functionality, being able to function, thrive in the community. Holistic approach, yes, of course, because we listen to the patients and we try to get them in a driving seats. And it's a team-based approach, as I mentioned, 24 hours a day. Can you imagine how intense that is? 365 days of the year, 24 hours a day, right? So why is the yellow answer a better answer than the blue one, right? Because the choice independence in managing daily tasks and responsibilities is the probably best answer that aligns with functional integration, right? Less restrictive environment is the goal of ACT. So if you know, this is something that I just created this today. If you want to take a picture of an ACT, it's probably a good time to do so. Okay. So, but if you don't want to take a picture, just remember ACT is a community-based approach. Team of professionals working 24 hours, and the goal to keep patients outside of the hospital. That summarizes ACT pretty good. Assertive community treatment. And obviously, one last point for non-compliance patient. Usually that is a high yield point. Okay. All right. So this is a hard question, right? But if you look at the core of the question, I wish I had taken a picture. It was about uh, kind of, how can I say? It was about, let me see if it's going to give me a clue here on the answer. It was about the scenario evidence characteristic of universality. Realize that they share, that is the, the definition, that they share similar experiences and struggle, fostering a sense of commonality, right? Now, did anyone took a picture of the question? No? I wish I had taken a picture because it doesn't show me there were some keywords in there.
Yes, I did.
You did?
Yes.
Can you read the question one more time, please?
In a therapy group led by a psychiatric mental health nurse practitioner, members actively engage in discussing their personal experience.
Okay, stop right there, please. So I was like, whoa, this is a hard question because all of those principles are Yalom, but discussing their personal experience. And then I looked for the first word of the answer, and that led me to the answer choice, which was a C. Okay, so learning to pick up the keywords from the question. When you look at all the answers, like, oh my God, they all look the same or similar. That would have give you the right answer. Okay, so now when we discuss those answer choices, right? Your universality, group cohesion, and the interpersonal learning. That all falls with the phrase that she just read, right? Because it corresponds directly to the behavior that was pasted in the question, right? So universality, I'm sorry, it is sharing personal experience. And yesterday I made a comment like, oh, I felt so ashamed of my major depressive disorder. And then when I come to a group, everyone has it. And I made a joke of kind of like, what did I say? Something along the lines that misery loves company, because before I thought I was alone, but now I see that others have the same problem. And therefore, I'm able to kind of learn and share my feelings with others that kind of understand where I'm coming from. How about group cohesion, right? Moving together, right? Represents a feeling of trust, belonging, and together in this experience, much like us going through the board right now. We have our WhatsApp group, and you guys bond pretty quickly because you guys are going through the same experience. Interpersonal learning, that is also part of the group characteristic by Yalom, right?
And
What else?
they do also say in the question that provide mutual support. So that
There you go.
it's everybody.
Yep. How about altruism, right? Gaining a boost of confidence by extending a hand. Yesterday we talked about when you do something nice for someone, don't think of them as taking advantage of you. If you did something nice, and it should be actually it's a boost of confidence, really is. Existential factor, what is that? Members accept responsibility for life decisions, right? How about catharsis? Anyone has a good example for catharsis? Anything that clicks with that? So when I think about catharsis, I think about uh, the Catholic Church confessing to a priest, right? Where one kind of like stay on the other side and there is this closet kind of, and the person's confessing. When that happens, they release suppressed emotions about what they think was a sin. And by doing so, promotes healing. And we talked about installation of hope, developing optimism for one's improvement by seeing the success of other group members, right? Now, yesterday we talked about A-Hill soccer, right? If we talked about A-Hill soccer and we said, okay, we have to memorize this because lots of questions will be on the board about Yalom, okay? So hopefully this was a good feedback, right? Here we go. There you go. Hands up. That's a good question. The emoji means this was in your task, so close related to the task. So I think it's a good emoji though. It's giving you important cues. All right, so that is Yalom in a nutshell, right? So if you didn't pick that, maybe you pressed the button on your phone kind of quickly, but I think it's it was a given because we just went over Yalom. Characteristic of group therapy is lots of them, right? Over 10. So it's important that you guys understand them ahead of time. It's much like Erickson stage. Takes a little while, but if you get the acronym and you do it early, the key is early. If you try to do later, you are not going to remember Yalom. Okay, so the issue is carve some time to learn them early. Okay, and you will do well on the board. Here we go. Okay, hard one because I was talking about boundaries, right? hard one because it was talking about boundaries. I couldn't read all the questions, so I was texting here the group in the Google Meet. So systemic or family system therapy systemic family therapy is designed to address issues related to families dynamics, which also has to some extent boundaries, including self-differentiation. You need to remember self-differentiation, which is the key concept for family system therapy. And so is triangles, and so is genogram, right? Remember yesterday we did an exercise in which we said writing down 3 things for each one of them will be so helpful. What are the 3 things that would come to mind in regard about structured family therapy, a strategic family therapy, DBT, or family system therapy? Would you be able to say it, So here, a little cheat sheet. So if you say DBT, what is really important to me is knowing who is the creator, is a name that you need to memorize, Martian Lyham. What is the goal of DBT? To decrease suicidality. And obviously, who are the population that we are actively seeking to enroll in DBT? Borderline personality disorder. Now, when it comes to family system therapy or systemic family therapy, you need to remember who Murray Bowen is known as the father of family system therapy or systemic family therapy. What is the main concept? Self-differentiation, right? Which means one can be part of the family, can have a role of a father or mother, but still maintaining individual core of who they are, right? Individuality while staying connected with the family. And remember, triangles and triangulations can be a bad thing and a good thing, and we discussed that yesterday. What are the few things that you remember about strategic family therapy, right? Directives. What kind of directives would you give? Problem focus, solution focus. What kind of directives would you give? Straightforward directives, paradoxical directives, and reframing. I know the question said boundaries, right? That is structural family therapy. Salvador Minuch is not super high yield, but think about boundaries, genogram, and enactment. Enactment, super high yield. What is enactment? Instead of listening to the problem, you ask them to play it out for you. What kind of faces did you make? What kind of tone of voice did you make? Play it out to me. Don't tell me the problem. That is enactment, is super high yield, okay? So if you see things like triangles and triangulations or self-differentiation, you think of a family system therapy, Murray Bowen. If you see boundaries or subsystems or genograms, is most likely talking about structural therapy. And if you see directives, straightforward directives, paradoxical directives, then you are likely to looking at a question that is strategic family therapy. All right, great, great, great. See you guys. All right, so the question said mapping, meaning genogram, and tracking, and said the goal there it was to change the structure of the family. Basically, it goes to structural family therapy, right? So focus on identifying and modifying dysfunction family structures by mapping genogram out of the family roles, boundaries, and hierarchies, tracking the patterns and interactions, and making strategic intervention to improve communications and resolve the power struggles. Oftentimes, the power struggles comes from lack of boundaries, right? Right. So it's about ACT. And again, what is the goal of ACT? Providing community support so they can thrive in the community. So the answer pretty much gave it out, right? In a sense. I know there's some trick options there, but that is the goal of ACT is having the patient flourish doing their best in the community, away from the hospital, preferably, especially away from inpatient settings. ACT is good for those with non-compliance or non-adherence to medication regimen. Usually questions comes along with that. All right, so what is in mind is non-confrontational, right? Motivational interviewing that is non-confrontational, that is eliciting changes when the patient is ready for a change, right? So if you ever find yourself picking an answer that you are pushing the patient towards a direction that they don't want to go, that is not motivational therapy, not for the board at least, okay? Okay, so explore the patient's concerns, doubts, past experiences with treatment, and elicit the values and goal. Remember that Cahoot does not allow me to put a full answer. So I have to be very, very creative to come close to an answer. And this is what the full answer would be like. All right, Doris, you have a question there?
Yeah, good evening, sir. I'm having problem typing my answer. I don't know where to put it.
Doris, I can't help you once the game started. You have to type in your phone. I mean, press the, if you are in the game, you have to use your phone Sorry. Maybe you can type it in. Someone can help as well. Okay.
Okay.
Sorry. Yes, folks, you guys need to come in if it's the case a little bit earlier so we can work it out those small issues. Sometimes it happens and sometimes it doesn't matter if you come in early or not. So when we do motivation interview, what are the techniques that we're looking for, right? First and most informal, we want to elicit, bring about the patient's willingness to change. If they're not ready for a change, don't force the change on them, right? And you do that by exploring what is important for them or resolving the patient's ambivalence for change, helping them kind of look for directions and exploring, are you ready for a change? We use principles like open-ended questions, affirmation, reflective listening, and summarizing. We talked about that errors yesterday. What is super high yield about motivation therapy is that you need to know frames. How? By the letter. Feedback, right? Providing the patient with objective feedback regarding their current health situation. Taking responsibility, emphasize that, hey, you're in the driver's seat. It's up to you if you want to change or not. Advise, offer clear, non-judgmental advices on the benefit of change or not change. M is super high yield. Menu of choices. Hey, you can do this or that. You don't have to be just medications, right? Often patient solutions. No one wants to be giving, this is the only way of doing it. Empathy. Empathy takes you a long way. It doesn't matter if it's with patients or co-workers or even inside of your own house. And self-efficacy, right? So need to memorize frame. You might get questions in which they'll give you an example and ask which of the following most likely represents one of the elements of frames. And then you need to know how to apply it. And sometimes it might be even questions that ask you exactly what the M stands for, and they give you 4 answers with M, and you're like, oh my God, they don't remember. Take the time now. Do it, your board preparation so strong that would be unreasonable for you not to pass.
There is no music.
Extremely hard question. Extremely hard question, right? Because the answer here kind of baited you guys to pick option A. Now, anybody took a picture of this question? Very hard question. Extremely hard question. And I can see why most of you guys picked A. Okay.
Yes.
So can you read that question one more time? Was about cognitive restructuring and somatic symptoms, right? Can you read that question there?
You are treating a 40-year-old patient with general anxiety disorder, GAG, using cognitive behavioral therapy, CBT. During the course of therapy, the patient exhibits significant improvement in identifying and challenging irrational thought related to their anxiety. However, they continue to struggle with excessive worry and somatic symptom. What should be your priority goal in
Okay.
ongoing CBT
So
session?
what was option A?
Reinforce cognitive restructuring to
Okay.
further challenge irrational thought.
Okay. So the question said that he already overcome the irrational thought, but still experience somatic symptoms, right? So option C, explore and address the patient's somatic symptoms and worries through problem-solving strategy. So it's
Mhm,
not so much the cognitive restructuring, because it seems like that he was already over that. He got that
mhm,
and the understanding, but it's still having somatic symptoms. In this scenario, the patient has made progress. He identified the challenging, irrational thoughts consistent with CBT. So he is past that. And this is why it was extremely challenging question, because option A was a great answer. Had he not gone through the still stuck in the rational beliefs and irrational thoughts and circling around that, right? However, they continue to experience excessive worries and somatic symptoms. This suggests that there may be other factors contributing to the anxieties that they need to address. By exploring and addressing the patient's somatic symptoms and worries through problem-solving strategies, you can target the remaining areas of concerns and provide a more comprehensive treatment option. So I get it. If you selected A, totally get it why, you know. But I think it was just one step beyond that, reading the question, asking, hey, wait a minute. I see that the answer is A. I think is A, but let me just verify it. And maybe some of you guys would have changed your answer on that one. Okay. Because A was super enticing for sure. Anybody got a question on this one? Well, kind of like after we went over, becomes a little bit easier. This was a hard question. Okay. If you got it right, I mean, if you got it wrong, don't feel bad, because I think a lot of people, as it did here, would pick A. Okay, so we talked about a little bit about what is CBT. We talked about, we broke it down: cognitive therapy, behavior therapy, and when they marry together, we have cognitive behavior therapy. If we're specifically talking about cognitive therapy, it's all about the irrational beliefs, negative thoughts, and cognitive distortions with more positive, realistic facts. That is cognitive restructuring. Cognitive restructuring, this word right here, it is super high yield, and you need to know what that means, right? If we are talking about the behavior in itself, we are talking about changing the maladaptive behavior. How do we do this? Relaxations, problem solving, role playing, modeling, right? These are things that come together uh, for behavior therapy. And then when we have the complete therapy, cognitive and behavior is about changing the irrational thoughts and changing the irrational behavior, making it productive behaviors, right? Remember, it's also very, very important when we talked about CBT, journaling, right? Creating the log, problem solving, which would be part of the behavior. And the primary goal, the logic steps, is to address those remaining symptoms using behavior tools. Okay. If we are talking about specifically about identifying distortions, the way they are thinking, we are talking about the cognitive therapy or cognitive restructuring. What are some of the cognitive restructuring, or like all or none? Uh, there are so many, right? We can use for CBT Socratic question. Instead of answering a question, asking the person to say, what do you know about it? Letting them speak. And it's always a present or patient present center, focus on the current problems, attitudes, rather than digging through into the past, because that would be more of a psychoanalytic. Okay. All right. So, oops. Hold on a second. All right. Oh, no. So it's kind of like this one is a bit of a black and white, but this is more of a catastrophizing, to be honest with you, right? So let's take a look over here. Catastrophizing, exaggerating the implication of an event. So it should have been A. So my apologies here. Why should have been A and not all or none? Anybody wants to comment on this one?
It sounded more like an exaggeration to me. Like it's not completely like like it's just more exaggeration of what happened. That's how I took it, and I chose that answer.
Yes, absolutely. Is so it was more of an exaggeration. I made a mistake. I am a complete failure.
I thought it was B though. I thought it was B for me because they were trying to express themselves that they are not good enough. That they were not good enough. So that's why I told B. They correct. I mean, what it says that because they were not good enough. They're trying to say they are not good enough. And all for nothing is I'm not good enough. I'm not good enough. That's what all for nothing means. I'm not good enough.
Yes. So the truth is that all and now
they're generalizing stuff. They just generalize their failure. So that is reason why I go for all or nothing.
Yes.
So they generalize everything. You fail once, you now generalize it. So
yes,
so
here's the all or nothing. He said, I'm a complete failure. That's like all complete.
Right. But
so
let me ask you a question though. I think the question was poorly written on my part. They should have been giving you a little bit more, because all and nothing and catastrophizing, they're like twins, brothers and sisters. But the question said a mistake, one mistake. When you make one mistake, for example, if I say I've been at my job for 10 years and then have never been late, I am late today. Oh my God, I'm going to be fired. So I think the reason for the confusion here, it was because the question itself wasn't a good question that didn't really give you a little bit more. But all or nothing is very close to catastrophizing. It can be as well, right?
Yeah,
so I could have given a little bit better scenario that would have made it a little bit more one way or another.
I felt like I needed more examples for all or nothing for me to have chosen that answer, because it was just a one all or nothing. It had to have been more several issues where he kept seeing the same.
Exactly.
So that's why I chose catastrophizing.
Yeah.
Hey,
right.
Dr. Lopez, I'm
Yes.
sorry. So I had done the question bank for the module 4 last night. Before this, I had originally picked catastrophizing on the question bank, but on the question bank it's saying the answer was B. That's why I wanted B, but I'm glad this question came up again, because at that time I thought the answer was catastrophizing as well. But then
Yeah.
when I did the question bank, it told me B. So I'm glad the question is there again. So
Yeah.
just a heads up, on the question bank, it is saying still that B is the answer.
Yeah, that's why they made this. I mean, the people that create the questions for me, for the Cahoot, because it takes about 8 hours to create a long game of Cahoot. I will actually double check on this question, but yes, I definitely agree that it should have gave you a little bit more, because right now we're all in offense, and they kind of could go both ways, all or nothing. But to be all or nothing has to be a little bit more into it, right? Is this one example, one thing? When he says, I am a complete failure because he made a mistake, one mistake, that is more catastrophizing than all or nothing. But I totally get it. I will revise this question. I'm glad that it came out, that we can talk a little bit more about it, okay? Yeah, so here, as I stated, it sometimes can happen, mistakes, and a little bit the question is poorly written. It does happen, I think the question could have given a little bit more, so that would have led you to all or nothing, or catastrophizing a little bit more than just one example and say choose one. Okay, so I might have been sleeping when that happened.
Dr. Lopez, when you look at the explanation of the B part, it says there that you do only, you just need to do one mistake, but you make it like that's what has been happening. So, and that's what the question was saying, because like look at the end of it, a single mistake, but you exaggerate
Yeah,
it.
that's the answer.
So that's
Exactly.
yeah.
So basically, what you're saying
It's correct.
is it is catastrophizing because you made one mistake.
No,
So that's why.
no, that's not what he's saying on the B
For
answer.
all or nothing, you only need to make one mistake.
One mistake,
And the
that's
patient, they would exaggerate it. So it
They
is all or
exaggerate it.
nothing.
Yes.
Yeah, it's correct. All or nothing is correct,
You
because
have to
it's
just
one
make one
mistake.
mistake, then you
And
exaggerate
they feel
it.
the world has crumbled on them.
Correct.
Right.
Yes.
So yeah, no, I mean, but that fits on both answers as well, right? Catastrophize, you made one mistake, and then, oh my God, I'm going to be fired because I've never been late to my job and I am late now. So
No, for me, for catastrophize, it's more like when you do something that is your worst thinking. It's not something that you do, it's bad, something bad. So yeah, like a worst feeling, a worst case scenario.
The
Like
worst
I'm gonna
case
kill.
scenario.
Yeah,
true,
but
true, the worst case scenario for sure. Yes, absolutely.
yes. So, but that
Right.
was not a worst case scenario. You came late. That's not a worst case scenario. But that's what I'm saying. The two different.
The other one is the correct answer. B, all or nothing.
I
Do
think
you guys think B fits a
Can
little bit
I
better?
It fits.
can
it
I
fits
say
the scenario.
something
yes.
before we
I
move
think B
on?
said-
Yes.
So, just for clarity for everyone, since everyone is talking about this, the catastrophizing would be the answer, because while I've been in therapy, when I was with the psychologist, that's the terminology they usually use. Most of the times we have like bipolar patients come into during the group therapy or cognitive behavioral therapy, and then they'll give one example about something and they say, oh my gosh, like this happened to me and my life is over. And that is a terminology that we use for documentation. So
Yep.
that's what I think Dr. Lopez is trying to say. So
Yeah.
yes,
I
all or
mean-
nothing sounds great, but that's the answer because that's a terminology that is used in psychology.
Yeah. No, absolutely. So I think the question was poorly written, so therefore everyone's kind of like, it can fit both answers, to be honest with you. So it's like a 49 versus a 51%. So I don't even remember anybody else picking anything else, right? So yeah, very closely related. So what should have happened is the question should give a little bit more in order to make the decision, not of almost a 50-50 here. So when we say like all or nothing, seeing the situation black and white, one mistakes equal total failure. If you say catastrophize, so it's predicting the absolute worst case scenario will happen, right? That kind of fits more with the previous definition. So I think the question needs a little bit more into it in order to make it a little bit less ambiguous. And nobody picked personalization and emotional reasoning here, right? I hope, unless it was a mistake. All right, let's move on to the next one. So again, talked about CBT, right? Cognitive restructuring, Socratic questions, and thought recording. These are important concepts, along with cognitive restructuring, as we talked about, all or nothing, catastrophizing, and there are tons of them, right? Not a tons, but quite a bit of them. All right. So what happened when the child, in this case an adolescent, is taking a role that shouldn't, or at least most family, be assigned or is assigned too early, right? So how do they feel, right? So explore, for example, think about your child. If you give them, say, hey, you have to cut the grass, wake up early, make sure that all your sisters and siblings have to do their homework and eating, well, they don't have time for themselves, right? So it's important to understand their feelings and that they will be emotionally taxed in this scenario, right? So we don't want to encourage the caregiver role without considering potential negative consequence and advise Sarah to set boundaries and refuse. No, I'm not going to do this anymore. It's probably not a good recommendation. Neither is recommending immediately family therapy as a valuable consideration, but should be based on a full assessment of the specific needs of the family and Sarah. All right. So yesterday, yes, the blue answer can be a little bit of a trap, right? Acknowledge guilt and address self-blame via cognitive behavior therapy, right? So, or explore the child's belief and assess for external factors influencing them. So, is it normal for a child to have this belief of a magical thinking, right? So acknowledge the child statement is a valid to seek and seek to understand their underlying reasons for their belief. The child may develop microceptions of the blame regarding illness due to various factors, including misinformation from peers, fears, and anxiety, right? So I think I did a little bit of a PAG here. Magical thinking is the hallmark of pre-operation. So if you remember the acronym that we talked about, so Peter can fly for sensory motor pre-operation, can for concrete and formal. Magical thinking is normal. So magical thinking, child believes that their thoughts influence the action, the outcome, right? Being bad decides the outcome of the external event, so such as in this case getting sick. What else is high yield for pre-operation? We talked about being egocentric and the implication. We give you an example such as, if I wish my mother was dead, and then she actually got in a car accident as a 7 years old, that could have a tremendous impact on me. I'm guilt. I wish she got into a car accident. She did. Now I don't have my mom. That can develop in a lot of guilt, right? In this case is, I got sick. I'm bad. I got sick, right? So remember, pre-operation age does not matter, guys, for the question, because we can have someone in sensory motor and being 35 years old, i.e., your borderline patients, right? Pre-operational magical thinking, egocentric language development, and the super high yield, you can differentiate between concrete and formal. How? Remember, the formal, it's all about abstract, being able to empirical thinking, science project, hypothesis. If you see a science project or hypothesis, please make sure you get formal operation as your answer, right? Because in concrete is, I like to think as a 2 plus 2, but in fact, book loves to say conservation, reversibility, logical, but they lack deep meaning behind of the logical thinking. Okay, and remember the C is before the F, meaning the F is the latest stage with abstract thinking. All right, good thing nobody picked the green, right? So everyone kind of understood the concept here. So why not the child has an age-appropriate view of the illness as a random event? I must done something bad, I'm sick or I'm bad. No, it doesn't have an age-appropriate view of the illness as a random event. This is connects to pre-operational stage, right? We talked about magical thinking in the previous slide. That is a clear case of application of the content that we learned. Can we not memorize it, but can we actually understand and apply it? So many people that pass the board express this, don't just memorize it. Can you apply it? Because the board will be all about application. We can give it to you, all the content that will be in a board, we actually do. But questions will always switch. Questions will always be asking, can you apply it? Because this is where you are as a master or doctor's prepared psychiatric mental health nurse practitioner to be very soon. All right, we got 5 seconds. Pick your best answer. All right, so recommend individual therapy for the daughter to address her frustration. That can be helpful, but will it solve the problem? So what is the core of the problem, right? Parents are resistant to change. Which answer would solve the core of the question? Facilitated open, non-judgmental communication to explore the family dynamics, right? That would solve the core of the problem. So if you ever find yourself, should I pick between A and B, go back to the question, say, what is the real problem here? What is the core of the question? And which answer solves the problem? This will create clarity on selecting close related answers, okay? All right. Yeah, I'm not speaking. I'm just giving a time for you guys to read and digest the content. All right, 5 seconds. Pick your best answer. And 3, 2, go. All right. What is the core principle of humanistic therapy, often called Carl Rogers therapy or person-centered therapy? Hopefully, if you attended yesterday's class and you really picked up on that, because that is super, super high yield, right? What did Carl Rogers say? All humans have the potential to self-actualization, self-directed growth. I pointed out 1 million times yesterday, but it's okay. If you were in the class yesterday and you still didn't get it, now we are putting this into how questions would show up, okay? So the most important 2 keywords for Carl Rogers, often called humanistic, Carl Rogers person-centered therapy, is self-actualization, self-growth. If you can remember that, it will save you from questions like this, right? Meaning that everyone has the ability to develop in their best, developing to their best capacity, right? So it doesn't look at the problem of who you are, but more you're still able, no matter who you are, to be the best version of yourself. So that is the underlying assumption that all humans have capacity. It doesn't mean that you are going to be Einstein. It just means, can we develop you with your best potential? Can we get you there? Okay. Yes. So good. So I put a little bit of Muslim. I'm glad that you mentioned that, right? So the core belief here for Carl Rogers or humanistic therapy is that humanistic therapy is built on optimistic, that people are good, right? I believe that. And this is why I don't even check things. I'm not like calling names on my classes, because I believe people are good. That's my underlying belief, that every individual possesses the internal resources needed to heal and grow, right? So for example, self-actualization, the central assumption is that the client has, or the patient has this born with ability for self-actualization, self-directed growth. The potential here is that believing that everyone has the potential to do and achieve their goals and live a best life, right? And it's, of course, it's patient-centered. When we say Rogerian therapy, is not so much important for the board here, but it's just good to say unconditional positive regards, right? No matter how bad they fail you, you still believe in them. And of course, in order for you to be in a chair and be able to say that, you cannot be, you have to be empathetic to the person's situation, right? And yes, authentic. Otherwise, they will see right through you. There is no way about it. And using reflections as a non-directive ways to reinstate and help them gain insight of the problem. Now, how does Maslow connect to this, right? So if you say humanistic therapy aligns closely with Maslow's, both theories kind of emphasize that once the basic physiological needs are met, humans naturally thrive for self-actualization. So I say this all the time. You are only here today because I promise you, you have housing, food, clothing. Yeah, rent might be late. Yes, car payment may be late, but the basics you have. And for that reason, now you are looking for the best version of yourself by going through school, by getting this board certification, right? So self-actualization, unconditional positive regards, it is the core for humanistic therapy. And we have to remember Carl Rogers. That's an important name to remember. We do not talk about 30 different names, maybe 6, 7, or 8 the most. Okay, so if it's in a course, if you see a name, make a little cheat sheet and write those names down and which therapy it belongs to. I made one for you today, okay? So don't worry about that if you didn't. Okay, so what is option A most likely resemble? Humans are driven by unconscious conflict and childhood experiences, right? So
Therapy.
Fraud.
yeah, fraud, yeah. And kind of like almost this too, right? The therapist's role is to analyze and interpret dreams and fantasy. If you find two answers that are closely related, you can cross them out. Now let's look at B. Behavior is primarily shaped by external rewards and punishment. Not necessarily for here, right? Humans have the capacity for self-awareness, choices, and responsibility. That is the core principle of existential therapy. Okay. So the therapy is grounded on assumption that individuals have capacity for self-awareness, choices. Making a choices or not doing anything is a choice made, right? Personal responsibility aligns with the client's concerns regarding meaninglessness and anxiety. Existential therapy aims to help the client explore their concerns, make meaningful choices, take responsibility for their lives. That is the core. Now, if we say how closely related it is to logotherapy? What do you guys would say? So existential therapy, self-awareness, choices, and responsibility, personal responsibility, right? You are here today because of the choices that you made, whether it's a good thing or a bad thing, we can learn from that. Okay. Now, sometimes when the therapist puts that out, there will be some self-confrontation, or they may start realizing I got what I deserve because I made those choices. Now, how is it different than logotherapy? Kind of want to talk a little bit about this because this is very closely related. No wonder they all fall under the same umbrella of humanistic. So if we say existential therapy is pretty much focused on freedom of choices or choosing freedomly, right? And because of that, you have to cope with the choice that you made, being responsible because you had freedom. You have a choice to go left or right. While we look at Viktor Frankl, you need to know Viktor Frankl, you need to know that belongs to logotherapy. It's actually a specific subset of, again, existential therapy. No wonder we kind of get confused a lot with existential therapy, but now it focuses almost exclusively what is the meaning of your life in all forms of existence, even the most difficult ones, through suffering, right? Finding meaning through suffering. These are key words for logotherapy. So what I really want you to get is this name here, Viktor Frankl, and then you should put in your paper right now, finding meaning through suffering. So if we say logotherapy, finding reasons to continue living even through discovering meaning in difficult times, suffering. So that is more logotherapy. And when we say existential therapy, we're looking for personal choices, the present moment, that is more towards. So here, terminal illness. I think somebody else said yesterday, oh, when they see terminal illness, it directs me directly to it, guides me to existential therapy. It's true, right? So it's more like existential therapy in those senses. Is it still very confusing? Logo versus existential therapy. I tried to break it down here because we didn't have a logo yesterday. Everybody good? Thumbs up or thumbs down? Thumbs up. Okay. All right. Guys, take a picture of this because this will save you. And you don't have to know all things. Logotherapy, meaning through suffering, finding the meaning of your life through suffering. Existential therapy, personal choice and responsibilities, right? And oftentimes, when someone is going through suicidal ideations or terminal illness, it fits really well with existential therapy. Now, I put this together just a few minutes ago before the game, maybe an hour ago or so. Humanistic often falls with Carl Rogers. Almost the same thing as calling humanistic. It's the bigger umbrella. What is important? Self-actualization, self-directed goals. Existential therapy. Anyone surprised you see Yalom? Yalom is a big founder of existential therapy, responsibility, existential therapy, making choices, being able to deal with those choices, right? And remember, A. Hugh Soccer as the therapeutic principles of group therapy. Logo, you need to remember Viktor Frankl, meaning to will, specifically in the face of unavoidable sufferings, difficult times. Family system therapy, Murray Bowen, what's important? Self-differentiation, triangulation, and again, triangles as well. GBT, Marshall Lineham, what is important? To decrease suicidality is the goal of DBT. Psychoanalytics, Fyodor, Sigmund Fyodor, unconscious mind, psychosexual stage, and repression. How about nursing models? Papalau, right? Therapeutic, client center. When do you set goals according to Papalau? Which stage is this? Introduction, work? I mean, the working stage was the terminal of the therapy that you'd set goals.
Working.
Working. Please know that is super high yield. Okay. Please know that because that's something that often comes up on questions. When you set goals, when you reevaluate the goals during the working phase. All right, 4 seconds. All right, so can someone give me what is the core of the question? Take all the fluff out in one sentence or very short sentence. What would you say the core of the question is?
Tracking.
Tracking.
Identifying
How
the
to track self-harming behavior. If you don't know about anything else, and this is all what you got, how would you solve that problem? Role playing? Is this how you track? No. Relaxation techniques? All of these things can be utilized, but the core of the question is, how do you track self-harming behavior? There is only one answer: journaling. It is high yield for CBT. Okay. You need to remember journaling for CBT. What exposure therapy is good for? Few things, right? But what are the main components of exposure therapy? That OCD, that's what you said? Not sure. That's
PTSD.
PTSD, OCD, what else? It can be many other things. Phobias, which is a form of anxiety, right? But yes, exposure therapy, very good for that. Okay. He's 16 years old.
Stop.
Hands is up is an important question. Somebody said I accidentally unpinned the slideshow and all I see is Dr. Lopes. Any suggestion, please? She can't play the game. Anybody knows how to solve that? I'm not sure how to solve that problem. So can you unpin the whatever you did, pressing the same button? Maybe you would be able to solve that. If anybody knows how to help her out, please. So yeah, this question was pretty easy, right? Now, autonomy versus shame and doubt. What age group is this? is the second one, right? We have this.
1, 2, 3.
1, 2, 3. Perfect, right? So what I'm trying to say is that you have to memorize the age early. It's going to take a while. There are 8 stages, right? You have to memorize the age, and I gave you a little video, the PAG system, that works really well. Now, it's not going to work if you try to test your model. You have to do the work ahead of time, okay, guys? You have to carve some time to get the Erickson stage, PAG, Fyodor, Yalom. All that takes time, okay? But if you keep practicing, you will get it. And age is super important for Erickson. I have 20 seconds left. All right. So if you read the description, it said existential dread, right? And we only have here option that would fit perfectly, which would be existential psychotherapy. Now, can you also, in the same scenario, can you use CBT? Yes, you is a possible choice. It's just not the best choice. Can you actually use DBT for emotional regulation? You still can, but it's just not the best choice. So we talked about existential therapy and how, meaning of life and your choices have consequences. Not making a choice is a choice. Not doing something is a choice. As my daughter said, why are you so mad? I didn't do anything. I say, exactly. That is the reason why I'm mad, because you didn't do anything, right? So existential therapy explore the meaning, right? Meaning in life and choices. Your choices have consequences, whether good or bad, right? And not making a choice is a choice. Not doing something is a choice as well, right? Psychodynamics therapy explore the unconscious conflict. Psychodynamics exploring the unconscious conflict and how those unconscious, unaware things that happened in the past affect us today. DBT is more towards dialectical behavior therapy, more towards bipolar, right? So, okay, but I'm not saying that if the same scenario, the patient presents as a person, that you could not use CBT. You can use CBT for anything. I have a couple right now that's going through issues, and then she is, I'm the medical provider, and then she's complaining that the therapist has used CBT, and that's like, well, I agree with you, but it still can be used and still can be beneficial. All right. Perfect. So let's take a look here. All right. Industry versus inferiority. What was the age? I think it was 9, right? So if we know the age, we would have got this question right. So resolves around developing a sense of competency or not being competent in industry, right? The child who struggles with this stage may feel inferior and incompetent. Things like being able to compare themselves to their peers in class is important. So interacting with peers and seeking adult reassurance before decision aligns with this stage. Hopefully no one picked intimacy versus isolation, right? So that is a totally different stage. What else? We had that trust versus mistrust. What is the age? 0 to 1. It doesn't align with that. And the other one was initiative versus guilt. Takes place in preschool age. So even if you thought, well, it might sound like initiative versus guilt, if you kind of knew the age, it would have helped you get you the right answer. So folks, please, please, please take the time, memorize the age, memorize the core for each one of those stages, because it will be on your board, maybe 4 or 5 questions. It's a lot of questions on the same content that you need to know. If you do it early, you get it. If you don't, you will be missing those questions in the most important test of your career. All right, we got 10 seconds. Pick your best answer. Right. So here, think about this for a second. We just covered Erickson few times, and there is no high stake in today's event other than you may not be making the podium. And even though we just covered the age and the core principle, we still, some of us is still making mistake. Guys, we need to learn from those mistakes early, okay? Initiative versus guilt. What is the mean age for that group? What was the age presented in the question, right?
3 to 6.
3 to 6. By knowing the age, you would have got this question correct. So please take the time to, it's going to be hard. It's going to be. There is no way about it. I do a little math. I show you in the course, but it's going to take you the time to rewrite it and see if it works for you. Okay? So I'm glad that you are making mistakes today. I'm actually very happy. No, it's just because if you do it now, you don't have to do it on the test date. That is the only reason why I'm happy. Okay? So if you are confused, that's your warning right now. Okay? We should get 100%, right? right, we have 10 seconds. Close to 100%. But again, it falls back to the same thing that we just talked about. Erickson will be on your board. PAJ will be on your board. There is no doubt. It's 100% guarantee. 100%. Okay. Even though age doesn't matter, but it really describes sensory modem stage, right? All right, 2 seconds, go. All right. Okay. Okay. Anyone, I mean, you don't have to. I'm just saying, I'm just curious and trying to find a way to understand why anyone picked pre-operation. Is there any specific reason so I can better understand your rationale or your thought process?
The age.
Age. Okay. Great. Thank you for that. Age does not matter in PAJ. Okay. Why would it matter? Let's say we have a 35 years old that freaks out because the therapist went away. Which of those stages in PAJ would this most likely align? Well, sensory modem.
Sensory.
So
Sensory.
it does not matter. What else led anyone, please? I mean, this is not judgmental. It's me understanding what you are going through so that we can unlock that portion. Why anybody picked the green? I'm more interested in the green than I'm interested in the blue, because there is something we can learn from this.
I think because it seems like an experiment. That's
Okay. That's fair. That's fair. It seems like they're experiencing. Okay. Was anybody confused whether this is the later stage or the early stage, and you didn't remember formal or concrete?
It's formal.
Okay. You thought it was formal?
Yes.
Why?
Because concrete is when they have the ability to do some experiments, like in school, just like chemical experiments to see the result. But informal, they are able to discern that the water, although it was poured in another cup that is small, has more volume, but the content is still the same.
Okay, so this is exactly what I want to hear from you. What you did is switch. You switch between the later stage and the one before that. So think of this way: the C is before the later stage. This is exactly what I want to hear from you. So thank you, because the C is exactly water transformation, ability, reversibility, conservability. That is the C. So if you ever think about science project, hypothesis, empirical thinking, think of the F. F is later in the alphabet than there is the C. So thank you for that. So hopefully, yeah, C before the F. That's what helps me. Which was the later stage again? Thank you. Because now you won't make this mistake again on your test, because both options will be on your test. So if you're looking at a science project, a physics project, a hypothesis, or higher level of thinking, that is the F, the later stage. If you're looking at 2 + 2, whatever is concrete, okay, I got it, I read it, I understood, then it is a C. Before the C, before you get to the F, you have to go later in the alphabet. So hopefully that helps you remember. This gets very confusing when you see it the first time. It's pretty easy. 5 weeks later, some people will forget, and that's why we need to understand what are you thinking, so the way we can unlock it, and you don't make the mistake on the test. Great.
Thank you so much.
Yeah. So now you won't make this mistake that you just got an extra point on your test, because it will be on your test. I promise you this too.
Okay.
Yeah, once you pick your answer, you can't undo it. I wish it would be possible, but it happens. All right, so this is the oral stage. I think everyone kind of got it. Sometimes with Cahoot, the phones can be, can be difficult. I totally get it, as long as you understand. So it was almost like the previous question. It just changed the person, the Fyodor versus Piaget, right? Or the oral stage in this case versus the sensory modem. Almost identical question. Here we go. Hands is up. You guys need to know that. Perfect. Okay, daily journal, very important for CBT. Okay. Here we go, folks. Hands is up.
Dialectical.
Yeah. Maybe not.
Everybody's gonna be dialectical.
Why are you answering?
I don't know how to. I'm not able to push it.
I'm gonna mute you here, my dear. Sorry. All right. Yes. Um, it's very high yield question, right? Whether it comes straightforward the way it did today or a little bit more convoluted, you will see this question on your board. Okay. So these are the question banks. They're all high yield. Our diagnostic test is super, super high yield. The new crash course review question bank is so high yield. All that takes time. Okay. So what I'm trying to say is that I get it where you're coming from, that is hard to study, but the material that you need is right in front of you. It's just taking the time to go through it, understand it. You will be just fine. Okay. Don't be anxious on your test day. Be happy that the day came, right? You've been waiting for this day for a very long time. All right. So the question said that, something along struggling with the meanings of life. And then everyone's probably looking for existential therapy or logotherapy. And then the question said self improvement or self-directed growth. Everyone should be aiming at humanistic therapy, right? What if it didn't have that portion where it said self-directed growth, right? Or meaning still, the bigger umbrella is what? Humanistic. What I'm trying to get to is that sometimes you are looking for an answer and you don't see it. Ask yourself, what's above that? For example, if you're looking for the right parietal, but you see the cerebral there, right? Where's the right parietal located? In the cerebrum. You will see tons of questions like that, where you're looking for something so narrow, but the answer is just a bit above it. It's just a bit the umbrella answer. Okay, in this case, it will be humanistic therapy developed by Carl Rogers. Or many people would say it's almost the same thing, right? Okay, so I think it was nearly identical a previous question, right? Just slightly twisted. So hopefully everyone that picked the wrong answer previously were able to pick the right answer now, right? So ACT is high yield for community-based therapy that empower the patients to participate in their treatment. Is also high yield for those conditions that are notorious for being non-compliant with medication. Right? We kind of went over this a little bit earlier. I think we're covering the same thing. All right, last question. All right, 3 seconds and go. All right, what was his age, right? Can you get the right question just by knowing the age? Initiative versus guilt. Around 3 to 6 years old. Obviously, you look at the description, it was all about initiative versus guilt, right? His description aligned closely with this stage. You know, doesn't want to engage in new tasks, avoid taking initiative, fears of failures can lead to guilt. Okay, so guys, there is no way around it. If you don't take the time to study, it's not going to be a good day, and we don't want this for anybody, right? In fact, the people that fail the test, sometimes they are so destroyed, emotionally destroyed, that it's so hard to come back. So we don't have to go through this if we do the right thing before, right? So take the time, do it for 8 weeks. When you're ready, you're ready. No rush. Don't rush the process. All right, so what happened today? So we went over module 4 yesterday. A lot of you guys show up today, so thank you for doing that. I know it's quite a bit of a work, but we got here who today? We got Rose. All right, she took the lead. What else? Q, Tina, good job, Tina. Y, and I forgot the 5th person. So all of you guys really are the champions. All of you guys made it the podium in one way or another because you learned something, or you got all the questions right and you learned something that you know your stuff. So we talked about Erickson, we talked about Piaget, we talked about Theodore, what else? Recovery model, ACT, family therapy, structure therapy, strategic, motivational, frame, cognitive therapy, behavior therapy. We talk about humanistics. We even talked about logotherapy, which can be confusing, and we learned something new. Keep showing up, keep doing it. Don't let your mood dictate what you do. Sometimes I don't feel like I want to work out. I will work out regardless how I feel, right? So we want to go. Thank you everyone for being here today. So next week, we are going to cover module 5, I believe. About 26 questions or so, module 5. They can be confusing or they can be very easy. If we learn the ethics, if we learn the laws in psychiatry. So show up, do what you need to do, get your hand out, active recall. Okay, so this is it for today. We have a few questions. Tina, do you have a question? Sorry about that.
Yes, it's okay. I think I asked you this earlier, but I just wanted to confirm. Going back to the high yield crash course review questions, are those the ones that are below the modules?
Yes, they are.
Okay. All right, so I already did that. Okay.
Yeah,
And
so
then-
they are below the modules in the question bank. They are not the 600 questions that I send in the crash course review. These are questions that I hear people being confused about, or they need extra help, and then I create a question to try to mimic what might be on your board. And a lot of people coming back and say, oh my God, this was very close. So don't skip it. Okay, so if we go back here, I'm going to show you right now where they're located, so everybody knows, and make time to do those. I would do those probably before the crash course. Before the diagnostic test, right?
Right.
So
Okay, so these right there.
these right there, they're only 65 a day. They're clocked, meaning timed. They will help you a lot. If you take the time, your answers is right here. Don't skip that.
Yeah, they were
Okay.
really good. And then my other one, I just wanted to remind you about the WhatsApp that you're gonna send for us.
All right, so let's do that right now. So let me open my email address. Let's see if it works that way. I'm not entirely sure. I'm going to give a QR code, and hopefully that is get you guys in. So let me say Q. Give me a second. Let me see if it works. If it works. 1 second. Not sure. Let me amplify it. Create a presentation real quick here. So if you are watching this, you can just join our group right now by getting your cameras ready. I'm just going to show for a few seconds, and then you can join the WhatsApp group. So let's see if it works. Let me show you. So let me know, because I never tried doing this way. Does it work?
It works.
Is it for everybody?
Yes, everybody can join now. So it's usually for the group, but I'm going to open up for you guys because you guys show up today. So go ahead, and if you want to join, by all means, right now. So everybody good?
Yes.
Yes, thank you so much, Dr. T.
Yeah, no worries. So this is kind of reserved for us, for the people that are in the course, because we talk a lot about a lot of things that goes on, and so I don't want to open this for everyone. But if you show up today, if you are present, that means you want to learn. So I really, I want to support you as much as possible. So that is the goal. So now let me go ahead and open for questions. Let me stop this recording here.
Dr. Lopez,
Yes.
the cases that you showed with